You're not, YouTube is not receiving enough video to maintain. Hello guys, so how are you all? So today we shall be discussing the session on anatomy. Okay, previously day before yesterday we have discussed the microbiology session, right? Obviously we will continue that microbiology sessions. Okay, so we shall continue discussing the entire microbiology, but parallelly we shall also continue discussing the anatomy. We shall also discuss the entire anatomy. Okay, like for example we are starting lower limb today, and if it is well and good, if it is finished immediately, then we shall start upper limb, head and neck, and everything we shall be discussing. Okay, Raza, hello. Brajesh, good evening. Sammy, good evening. Star Rider Sandeep Yadav, good evening. Good evening. Right, sound buzz too much. What happened? There is any sound problem? Deepanshu, good evening. Yeah, good evening all. John Banda, good evening. Hello, how are you? I'm fine. King Amninder, I'm fine. Sound problem? Sound problem. Krish Patel, good evening. Right, so let us wait for 1 more minute and then let us start. 1-2 minutes. When we have enough number of students, we shall start. Okay. Sound comes with radio type. There is some disturbance. Give me a second, guys, so that I can rectify my sound problem. Hello, 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 hello. Start. Hello, guys. Mubashar, Mujib, how are you? I'm fine, thank you. Amulya Rao, hello, thank you. Ayesha Khan, good evening, Ayesha. Gautam, I thank you. Krish Patel, Lokesh, Lokesh Atri, hello, hi. Anjana Paul, I hope. Roy, the old gamer, hello, how are you? Sanyasi, Pandit, how are you? Iomide favor, hello. So, right, let us start. Okay, let us start the session now. So, guys, the thing is, let me go straight. I'm discussing lower limb. Okay, we shall complete the complete lower limb. We shall discuss everything, the muscles of the lower limb. We shall discuss the arteries, the veins, the nerve supply, right? And in between that, I shall also directly put a screenshot of those questions which are previously asked in your exams. Okay, and I'm definitely sure that all of you will answer it, right? So there are two ways. You want me to draw and teach, or you want me to put a PPT and just teach? Tell me. Brajesh, Shripal, Savita, Shripal. Hello, hi. Hi, Shravita. Mahek, okay, draw and teach. Anjana Paul, draw and teach. Krish Patel, draw and teach. Right, fine. So, right, so let's mid booster. Hi, hello. So let me get started. Let me get started with this. So let us first of all write the heading. Okay, we are discussing regarding the lower limb. So I'll be teaching you. I'll be teaching you only those things. I'll cut down all the scrap and will be teaching you only those things which are important for your exams, for your MCQ as well as your MBBS exams, you know, for the first year students to form very good basics. Right. So before I discuss, first of all, from where does lower limb start? Look here, guys. All of you know that All of you know that this is a pelvic bone. All of you know that this is a pelvic bone, right? Uh, Yes, PPT teaching would be faster in other subjects. PPT teaching would be faster in other subjects, but subjects like, you know, anatomy and all, when I draw and teach, you know, a single picture speaks 1,000 words, right? So that pictorial memory is very strong than a PPT, fine? So this is a pelvis, all of you know, right? In this pelvis, we have got many different parts. Now, this part is called as the pubic region. This part is called as the pubic part. Now, in this pubic part, you got a crest here. You got a small elevation over here. This is called crest. And this one is called as crest, and this is called as pubic tubercle. Right? This straight part is called crest. This elevated bumpy part is called pubic tubercle. And what is this? What is this called? This is called as anterior superior iliac spine. Okay, this is called anterior superior iliac. Why anterior? Because it is facing to you. So it is called anterior superior iliac spine, anterior inferior iliac spine. We are not discussing about this one. We are discussing about anterior superior iliac spine and pubic tubercle. Okay, anterior superior iliac spine and pubic tubercle. Right. So this was your anterior superior iliac spine. This is your anterior superior iliac spine, right? What is this? Anterior superior iliac spine. Next, this part is called as a pubic tubercle. What is this called, guys? Very good. Pubic tubercle. And this is called pubic crest. What is this called? This is called as pubic crest. I want all of you to make notes, guys. Wherever I tell you to stop making notes, you have to stop it, okay? Because the concepts might be a little bit difficult, but I'll make sure that you'll understand everything, fine? So between, from anterior superior iliac spine till pubic tubercle, you have got something that is connecting this anterior superior iliac spine to pubic tubercle. What is that, guys? Please comment now. No video. No video on top. Only white screen. No display. Right, now it is fine. So what was I telling you is that something that is connecting anterior superior iliac spine to pubic tubercle. Can anyone tell? Yes, Roy the old gamer, you're perfect guy. Inguinal ligament. Excellent, you're excellent. Inguinal ligament. Inguinal ligament. Now look here. This is where the lower limb starts like this. This is where the lower limb, it starts in this way. And this is your patella over here, right? And as you go down, this is your leg. This is your leg. Okay, so what is this? This part is your thigh, this part is your leg, and this part is your patella. I'm just forming the basics, guys. I did not enter into deep into the topic. Okay, now in the leg you have got two things. One is called medial malleolus, another one is called lateral malleolus, right? So what is this called? Medial malleolus. This is called lateral malleolus. Lateral malleolus. Now between the medial malleolus and between the lateral malleolus, you have got your leg, right? Now look here. So what are the things we have drawn here so far? We have drawn thigh, we have drawn inguinal ligament, and by the way, I'm sorry that this is your inguinal ligament. Inguinal ligament. Okay, this is your thigh, this is your patella, this is your medial malleolus, lateral malleolus, and this part is your beautiful foot. Okay, now we shall decode each and every part. We shall first discuss what is thigh and all and all and all. Fine, right? Now can anyone tell me how inguinal ligament is formed? This was a question in 2013. In 2013, they have given a question that inguinal ligament is formed from. How does inguinal ligament form? Yeah, any answer? Can anyone answer? Yes. In the meanwhile, I'll show you something that I can teach you with the help of this. Right. Can anyone answer how inguinal ligament is formed? Very good. Very good. Aniken, yes, you are right. Sannyasi Pandit also, you are right. See guys, simple. This is the abdomen, right? In the abdomen, you have got transverse abdominis, you have got internal oblique muscle, you have got external, all those muscles are there. You have got a muscle called external oblique muscle. So that external oblique muscle is like this, okay? That external oblique, let us say the external oblique muscle is like this. What will happen is that exactly near the inguinal region, this is called as the lower part of external oblique muscle. This is called the lower part of external oblique muscle. The lower part of external oblique muscle will make a U-turn like this. It will make a turn. You see, it has made a turn. It will make a turn. It will fold inward like that. So when it is folding inward, you see a small cavity inside. This cavity is called as inguinal canal, and this entire ligament is called as inguinal ligament. I hope you understood. You understood my explanation? Yeah? Right? Anjana Paul, yes. Aponeurosis of external oblique muscle. Very, very good. Let us continue now. Okay. So all of you understood, right? Whew. Right. Now, we shall be discussing. Very good. Northwind, Aniken, MD. Yes, yeah, fine. Now we shall start discussing with the thigh region. Now look here, guys. Let us now enter into the topic. So far what I have discussed is the basic, and this is the expected MCQ. That is the expected MCQ. Now you will come across a lot of MCQs, guys. First of all, let's start discussing with the thigh. Thigh has got 3 compartments. We shall discuss the muscles of 3 compartments and everything. Okay. So what I'm trying to do is that when I cut down the thigh, when I make a transverse section, see, when I'm making a transverse section of the thigh, what is the center part of the thigh? The center part of the thigh will always be your bone. Right? What is this bone? Femur. Isn't it? This is called as your femur. Now, outside the thigh, the outermost layer of the thigh. What is this outermost layer of the thigh, guys? Anyone? Outermost layer of the thigh will be, now you need to answer first. Outermost layer of the thigh will be, yes, very good, skin. Just beneath that outermost layer, we have got a second layer, right? We have got a second layer, and that second layer is called as superficial fascia. That is called superficial fascia. Superficial fascia. Below that superficial fascia, we have got another layer, and this is called as deep fascia. What is this called? This is called deep fascia. What is this called? This is called deep fascia. Okay, I hope all of you have heard a term called as fascia lata, right? When you are studying anatomy, you have heard a term called as fascia lata. What is fascia lata? Deep fascia of thigh has given another name, that is what is called as fascia lata. Fascia lata, right? Deep fascia of thigh is itself called as fascia lata. Now, this deep fascia of the thigh will give some connections. Okay, look here, this deep fascia of the thigh will extend like this, it will extend like this and attach to the femur bone. On the other hand also, the deep fascia of the thigh will come like this and attach to the femur bone. From back also, the deep fascia of the thigh will come and attach to the femur bone. Okay. One very important thing you all have to remember is that, guys, very important thing, this is called as the anterior side. Now you are telling me, sir, you have drawn a big circle and you are telling me that this is anterior. How can you tell me that is anterior? How can I tell you is that, look here, this is a femur bone, right? Look on the front of the femur and on the back of the femur. What is the difference, guys? Front, it is completely concave. Sorry, it is completely convex. It is rounded. But back, can you see a line like this? Can you see a line here? All of you can see a line here on the back side, right? This line, yes. Give me a yes if you can see this. Let me put it like this. Can you see a line like this? This line is nothing but called as linea aspera. Okay. See, look here. This is the line. This line is called as linea aspera. Always remember, linea aspera is located posteriorly. So this will be the anterior side of the thigh and this will be the posterior side of the thigh. Okay. So look here, linea aspera, this linea aspera is located posteriorly. So that will be the posterior side of the thigh and the remaining will be the anterior side. So obviously I can write here as posterior. Okay. Now this is called as a medial side. This is called as a lateral side. Anterior, we have got anterior, medial, posterior as well as the lateral side. Okay. So the deep fascia of the thigh has divided the thigh into three segments, three compartments. So this compartment which is facing the anterior is called as the anterior compartment, isn't it? This is called as the anterior compartment. Whatever is facing posterior, this is called as the posterior compartment, isn't it? Posterior compartment. Whatever is facing medially, this is called as the medial compartment. So how many compartments do we have? Three compartments. Out of these three compartments, which is the largest compartment, which is the bulky compartment? Anterior compartment. Now you can ask, we don't have any muscles in the lateral compartment? No, you don't have any muscle in the lateral compartment. Okay, clear everyone? Right. Now, a single important thing I'm telling you, anterior compartment has got a couple of muscles. Let us say 5 muscles, 6 muscles, how many number of muscles, I don't care. But all these muscles, as they're located in a single compartment, they are supplied by a single nerve. So they are supplied by a nerve called as femoral nerve. Femoral nerve. Okay. Second important thing, you have seen patients of age group more than 60 years, they complain of severe back pain and they tell the doctor the back pain is shooting down till the leg. You know, most commonly you have heard this back pain. What is that back pain named as? Yeah, tell me. Sciatica, very good. The back pain is named as sciatica. Anyone more? Is Roy the old gamer right or wrong? Sciatic. Yeah, sciatic pain. So posteriorly, why it is called sciatic pain? Because posterior compartment, you have got sciatic nerve. Sciatic nerve. That is why you call it as sciatica pain. Medially, what is happening? Medially, what is happening is that, guys, look here very carefully now. Very, very carefully. Look, this is your pelvic bone and I'm fixing it. Okay. If I'm fixing it, this will be your anterior compartment. This is facing my side. This is the posterior compartment. This will be the lateral compartment and this will be the medial compartment. Now tell me, now look here and tell me, medial compartment is towards this opening. You can see this opening here. Let me turn it a little bit, right? This medial compartment is towards this opening. This opening is called Obturator Foramen. So the nerve that is supplying the medial compartment must be called as obturator nerve. Very good, Aniken. It is obturator foramen. So the nerve should be obturator nerve. Why am I telling you this, guys? Why am I telling you so detailedly? Because every point I'm telling you is a clinical point. You know why that nerve is named as obturator nerve? Because it passes through obturator foramen. So what? So whenever there are any fractures of the pelvis, whenever this ring is destroyed, in the question they will ask you, a patient is driving so fastly, he met with an accident, he got this ring destroyed, which nerve will be damaged? Then you must know that the nerve that is passing is obturator nerve, so that would be damaged, right? Now, you know how simple the exam questions will be? Let me show you an example, guys. Let me show you an example. Yeah, look here, guys. Look at this part here. Look at this. Look at question number 155. Look at question number 155. What is the question telling? Yeah. Look at question number 155. Medial compartment of thigh is supplied by which nerve? This was asked where? 2018 they have asked you. Medial compartment of the nerve is supplied. Very good. Excellent. Excellent. Hussain Raza. Excellent. Saint. Excellent. Mehak. Excellent. Yes. Aniken. Excellent. You're very good. So this was a question that was asked previously. Okay. And right, as we are discussing, I will be telling you the remaining questions which are asked. Okay. So let us classify now. Very good, Niveta Sri, you're right. So lower limb, Sammy, you're right. Lower limb is divided into three compartments. Three regions. Lower limb is divided into three regions. One is called thigh, one is called leg, another one is called as foot. All of you know that. Now we are currently discussing about thigh. In the thigh, how many compartments did I see? I have seen three compartments in the thigh. Okay, three compartments I have seen. The bulky compartment is called as your anterior compartment. I have seen posterior compartment. I have also seen the medial compartment. Now, in the anterior compartment, what did I discuss? Till here, I have explained you. Madhukumari, anterior, posterior, medial, you are right. Saint, you are also right. John, you are right. Anterior compartment has got few muscles, guys. Okay. So what are these muscles? I'll be telling you right now. But if I name any muscle, let us say one of the muscle of anterior compartment is rectus femoris, for example. Then which nerve is rectus femoris supplied by? I have already told you. What is that nerve? What is that nerve that is supplied to rectus femoris? Femoral, very good. Anterior compartment is a bulky compartment completely supplied by femoral nerve. So any muscle I take out from anterior compartment, it will be femoral, right? Right. Now, so first thing, nerves are completed. Anterior compartment nerves are finished. Let us look at an action of the muscles. So your anterior compartment will cause two actions. It will cause flexion of hip. It will cause flexion of hip. It will cause extension of knee. Extension of knee. See, for example, guys, when I'm kicking someone, right? When I'm kicking someone, what will I do? First of all, I'll bring the leg towards my chest and then I'll kick him. Isn't it? So whatever I'm doing, I'm bringing the leg towards my chest. So that is called as flexion. When I'm kicking, what is happening? Only my knee joint gets extended. So that is called extension of knee. Okay. So anterior compartment muscles does these two functions. Okay, fine. So what about posterior? I don't know what is posterior compartment. I don't know what is the action of posterior compartment. Then how are you able to tell us? Simple thing. Opposite of anterior is posterior. What are the functions of anterior are there? Opposite of that will be posterior, isn't it? So flexion of hip previously, now flexion of knee and extension of hip. Extension of hip. Extension of hip, right? Then what about medial compartment? Very simple thing. Very simple thing. See guys, this is your medial compartment, isn't it? Anterior, posterior, this is your medial compartment. Look here very carefully. In the medial compartment, if there is a muscle here, if I'm pulling this muscle, then my leg moves like this, isn't it? If I am catching and pulling the muscle, the leg is moving like this. It means leg is moving towards the center of my body. If leg is moving towards the center of your body, you call it as what? Adduction. You call it as adduction. So all the muscles of medial compartment perform a single function. That is why they are called as adductors. They are called adductors. Before I start the muscles, till here, is everyone clear with my explanation? Yeah? Niveta, it is very easy. It is very easy, right? Look here. I am extending my fingers, I am closing my fingers. So when I am separating my fingers are going away from each other, isn't it? See, they are going away from each other. Again, they are coming back to each other. Again, they are going back. Again, they are coming together. So anything in your body that is going away, that is called, what is that called? That is called abduction. Anything that is coming close, that is called adduction. Simple way, guys. Remember it for your life. Remember it for your life. Look here. B A D. Remember it like this. And L A B. So remember this thing. B means body. Towards my body. Towards my body is adduction. L means laterally. It means away from my body. That is abduction. Okay. Satish Nakum, yes, I'll send you the book. Don't worry. So let us start now. Let us start. All of you guys, I want you to pay attention. All of you, Madhukumari, you are right. Yes, you are right. Very good. I want you to pay attention. Look here. Now don't waste your time drawing this. Now this is your pelvic bone. This is your pelvic bone. And let us say that this is your femur. This is your femur bone. I hope all of you are clear. Right? I'll send you the book. Don't worry. I'll send you the book. Right. Listen to a class now. Listen to the class, that is very important. This is femur, and here we have got a bone. This is called tibia. This is called tibia bone. Okay. Now look here. All of you know that I told you that what is this called? What is this projection called? And what is this called? What is the upper one called? What is this upper one called? Yes. Okay, fine. What is this upper one called? Very good. Axis. What is axis? Very good. What is axis? Not Asia, Shami, Shaima, Faruqi. It is not Asia. Anterior superior iliac spine. Very good. At least you tried. Very good. Anterior superior, not inferior. This is superior. This is inferior. This is on the top. This is below. It is inferior. Right? So, starting from anterior superior iliac spine, look here very carefully now, don't write. Starting from anterior superior iliac spine, all the way you have got a muscle like this. In this way, all the way you have got a muscle like this. Now, this muscle is where it is originating. Origin of this muscle is anterior superior iliac spine. Where is it inserting? I for insertion. Where is it inserting? It is inserting to the medial side of tibia. Medial surface of tibia. Okay. See, this is towards the body. This is away from the body. Towards the body is medial. Away from the body is lateral. Simple thing. Okay. Now, sir, there are many muscles in the body. Should I remember origins and insertions for each and every muscle? If you are a first year student, if you are studying anatomy right now, then you have to remember it. But if you are preparing for an exam, you need not to remember it, because in the exams, as per the new curriculum, they are not asking origins and insertions. Okay, don't worry about that. If you know the action, that is well and good, very good, fine. But if you are a first year student, then you have to know it. So this muscle, what is the shape of this muscle, guys? Is it A shape, B shape, S shape, D shape? What is its shape? Girijesh Kumar, you are right. John Banda, you are right. What is the Brajesh, you are right. Yes, I just asked the shape, not the name of the muscle. The shape is S shaped. Very good. So S for Sartorius. S for Sartorius. So the name of the muscle is Sartorius muscle. So what are the points can you write about Sartorius? I can tell you that the first point is Sartorius is a S-shaped muscle. Sartorius is a S-shaped muscle. Second important thing is that Sartorius is also called as Taylor's muscle. You know why it is called Taylor's muscle? Because it is useful for tailoring. You know, while tailoring, you push the pedal up and down. For tailoring, it is useful. Third important thing. Sartorius is called as the largest muscle of your body. Largest muscle of your body. Sir, you are telling me little bit small facts. Okay, you are telling me small facts. Do you think really they will come in the exam? Let me show you. Let me show you this, that okay, right, I'll put up a question anyways. I'll put up a question I don't have right now, right? There was a question, which is the longest muscle of the body, and the options which they gave was tensor fascia lata, option B gluteus maximus, option C Sartorius, option D popliteus. What will be your answer? What will be your answer? No, Roy, it is not gluteus maximus. Gluteus maximus is not a muscle of anterior compartment. That is a muscle of back, gluteus muscle. You know, you slap on the back, it is on the back muscle. It is a back muscle. Okay, right. So very good, very good, very good, Sartorius. See guys, simple thing, I can guarantee you that whatever I'm teaching you, if you practice it, if you revise it, that is more than enough for your exams, believe me, and mark my words as well. Okay, right. Now why it is called, look here, it is also called, it is also called as honeymoon muscle. It is also called as honeymoon muscle. Lagging, lagging. It is also called as, okay, let me rectify it. Let me rectify it, guys. Let me rectify it. Yeah, okay. Fees offer. Okay, let me rectify it. Please, I'm sorry. Is it still lagging, guys? Yes, we are good. Fixed, fine. So why, my question is, why it is called as honeymoon muscle? See, what do you do in the honeymoon, guys? Now, I know that all of you have not reached that stage. All of you have not reached that stage, but whatever you do right now is called as a pre-honeymoon, right? Whatever it is. So what do you do in a honeymoon? So why it is called honeymoon muscle is that this sartorius muscle is responsible. For example, these are my thighs. Okay, these are my thighs, don't take me wrong. If this sartorius muscle contracts, there will be flexion of my thigh, right? And my thighs will open out, my legs will wide spread out. I mean, not my legs, so they will wide spread out. So that is called, laterally moving legs are called as abduction or adduction. Yeah, I have told you, laterally if it is moving, abduction. So what are the things? Flexion, abduction. That is the reason why you call it as honeymoon muscle. Okay, sartorius is responsible for flexion and abduction. So why you call it as this? Because of flexion, abduction. Abduction means what? Other name they can give you. Instead of abduction, they can give you lateral rotation. Both are the same. Lateral rotation, right? See, you are answering so fastly for this type of question. I'm really, really happy for you guys. But whatever it is, anatomy is anatomy. You have to learn it. So far you are clear, right? So far you are clear, right? Very good, very good. Right. So let us, why don't we make a box? Why don't we make a box and discuss the muscles? Anterior compartment muscles. Anterior compartment. The first muscle which we discussed was sartorius. Sartorius. Okay, sartorius. Now the second muscle. Before I discuss second muscle, I want all of you to put your pens down and just listen to what I'm telling you, because this is gonna be the biggest important topic or biggest important point I'm gonna tell you guys. Definitely there will be an MCQ from this. Okay, even myself, I have not attempted this MCQ when I was a student, when I got this in the exam. All of you look here now. Just stop commenting. Just look at this. Look here now. Apart from sartorius, we have got few muscles. The first muscle is straight and it is in the center. Okay. The first muscle is straight. See, it is straight like this and it is in the center like this. It is in the center. Okay. So a muscle which is straight, you call in Latin it as rectus. Rectus, it is in the femur bone, right? Femoris, rectus femoris. Now I am discussing the next muscle. Next muscle that is located laterally like this. That is located laterally like this. That is located laterally like this. So this muscle is very large. This muscle is large, right? In always remember in Latin, for small things you call brevis, for long things you call longus, for large things you call vastus. Okay, so this muscle is little large, so I call it as vastus lateralis because it is on the lateral side, right? Next muscle, there is a similar muscle which is large and it is on the medial side. Similar muscle which is large and on the medial side, so it has to be called as vastus medialis. Excellent guys, you are really perfect. All your answers are right. Anjana, Paul, Niveta, Yash, Ranjan, Shaima, Dikshita, right? All of you are correct. Vastus medialis. Next, vastus lateralis is finished, vastus medialis is finished, and there is another large muscle in the center. I am drawing it with a blue sketch. Okay, there is another muscle in the center like this, in the center like this. This is called vastus intermedius because it is in the center, intermediate part. Vastus intermedius. So how many muscles we have discussed? Straight muscle in the femur, rectus femoris. Large muscle laterally, vastus lateralis. Large muscle medially, vastus medialis. Large muscle in the center, vastus intermedius. Right? Now, all these muscles, remember very carefully, all these muscles, they join together. All these four muscles, 1, 2, 3, 4, all these four muscles, they join together to form this green color tendon, and this is called as quadriceps tendon. Quadriceps tendon. Quadriceps tendon. Now look here, another interesting thing. Quadriceps tendon, it comes down all the way like this. Look here. Quadriceps tendon is coming down all the way. It is coming down all the way. It is passing over the patella. It is passing over the patella. Once the quadriceps tendon passes over the patella, now you have to call it as patellar ligament. What do you call it as? You call it as patellar ligament. And this patellar ligament inserts to your tibial tuberosity. What is this projection? Tibial tuberosity. All of you guys, on your knee, just palpate, just below the patella, you palpate that region on your knee. You will find a bumpy elevation there. That is called tibial tuberosity. All of you can palpate it, right? Just below your patella, you can see a bumpy elevation. That is called tibial tuberosity, where your patellar ligament gets inserted there. Right? All of you are with me, right? Am I clear, guys? We are done with the anterior compartment now. Am I clear to all of you? I want your reply, right? Exactly after exactly in 15 minutes, I'll give you break. Okay? You understood, right? Yes, you understood. Shaima, you understood. Niveta, you understood. Fine. Very good. Thank you so much. Right. Yeah. So, now I am asking you a question. Vastus intermedius is supplied by which nerve? Anyone? Very good. Femoral nerve. Next question. What is the function of muscles of anterior compartment? What is the function of that? Yes, you are right. Sabika, you are right. Shaima, you are right. Moments in life, you are right. Anjana Paul, Mehak, Brajesh, all of you are right. All of you are right. MBBS, from FSC to MBBS, you are also right. Pfizer Zafar, you are right. All of you are answering excellently, guys. Very good. Tell me, what is the function of the anterior compartment muscles? I told you in the starting itself. I have drawn a box, I think, right? No, not a box. Yeah. See, I told you there is flexion of hip. Very good. Dikshita, very good. Sabika, Saint, Aniken, Niveta, Malhar, all of you. Yes, excellent. Extension of knee. Not only extension of knee, you should answer both. Flexion of hip and extension of knee. Extension of knee. Fine. Very good. Very good, guys. So we are done with anterior compartment muscles. So what are they? Sartorius. And we have got vastus muscles. 3 vastus muscles. Vastus medialis. Vastus lateralis. Vastus intermedius. Vastus intermedius. Okay. Vastus intermedius. And third important thing, we have also got rectus femoris. So all of these are the muscles of what? Of anterior compartment. Anterior compartment. You know the action, you know their action, you know their nerve innervation, right? What nerve is supplying, what is the action? Very good, perfect. Now let us switch on. Now let us switch on to medial compartment. Medial compartment. Okay, guys, I will discuss this medial compartment and then I'll give you a break for 5 minutes. Then we shall discuss a very important topic, that is femoral triangle. You will wonder how many questions are asked on femoral triangle. So, you know, in 4 years back, right, regarding the lower limb, definitely the first thing all used to study is femoral triangle and then the remaining things, because definitely you will get a question from femoral triangle, right? Shaima, you are right. Grijesh, you are right. Yes. Now pectineus muscle, I'll explain you what is pectineus and all, right? I'll explain you where it is. All of you are right. All of you are right. Right? Yes, yes. Anterior compartment, pectineus is from anterior compartment only. Okay. That is also from the anterior compartment muscles, but that is located medially, right? So there is a confusion between the medial and the anterior compartment regarding the pectineus muscle. But anyways, you know, every book has its own theory. So whatever it is, that is not that much important for us now. Right. Let me tell you now. Let me tell you. Let me cut this part itself, guys. Right. Very good. Very good. Very good. Very good. Yes, it is below. Moments in life. Yes, it is below. Okay. Now look here. Look here very carefully. Your attention is very much important for me now. Your attention is very much important. Now, look here. Here in the thigh bone, whatever you can see here, this is called as a greater trochanter. Okay. Let me show it to you. This is called greater trochanter and this is called lesser trochanter of the thigh. Greater trochanter, lesser trochanter. From the front, greater trochanter, lesser trochanter. But in between these two trochanters, you can see a black color line here. You can see a black color line like this, right? Now, just near here, near this black color line, you have got a very small line and that is called as pectineus line. You have got a very small line there. you have got a very small line. Look here, this is a small line like this. This is called as pectineal line. What is this line called? Pectineal line. Okay, now look here. Within the pubic bone, this is the pubic bone, right? Within this bone, this is called as superior rami, this is called as middle rami, and this is called as inferior rami. Superior rami, middle rami, as well as inferior rami. Okay. Now look here. From the superior rami, you have got a muscle that is getting attached to your pectineus. You have got a muscle that is getting attached to the pectineus muscle, pectineal line. This muscle is called as pectineus. Okay, this muscle is called pectineus muscle. Pectineus muscle. Very good, Shaima, very good. This is called pectineal muscle. Next, look here, guys. Look here. Very, yeah, intertrochanteric line. Very good, intertrochanteric line. Look here. If I am moving my femur, medially, right? What action am I doing? For example, let us say I'm contracting. This is the pectineus muscle, right? Pectineus muscle is catching and contracting like this. It is pulling. When it is pulling, the femur will move towards medially, isn't it? It is catching and contracting. So when it is contracting, the femur is moving medially in this way. So all these are called as adductors. All these are called as what? Adductors. There are three types of adductors, guys. There are three types of adductors. Now look here one by one. From the middle rami here, there is another adductor that comes all the way like this. Okay. Now just below that, from here, there is another adductor. Right? All of you stop commenting now. It's time to listen. From here, you see another adductor like this. Okay. Next, look here. From here, you come across a third adductor. I can't show you here, guys. I can't show you this one here. Rather, I will show it to you here. Yeah, look here now. From here down, you come across another adductor like this. You see how many different types of adductors are there, guys? How many different types of adductors have I drawn? 3. I have drawn 3 different types of adductors. Now I am naming all of these adductors. Now you will tell me the name. Okay. This is called 1, this is called 2, and this is called 3. Out of these 3, which is small? Out of these 3, which one is small, guys? No. Out of these 3, which one is small? Lengthwise, widthwise, which is small? Very good. The first muscle is small. So if first muscle is small, as a rule of thumb, can I call it as brevis? I can call it as brevis. But this brevis muscle is performing which function? It is performing adduction function. So I am calling this muscle as adductor brevis. Adductor brevis. Compare 1 and 2. Out of these 2, which is large? Second one is large. So I am writing this as Edector Longus. Okay. Compare 1, 2 with 3, which is very large. Third one. So what did I tell you as a rule of thumb? Small one is called brevis. Large one is called longus. Extremely large is called vastus. Right? Extremely large one is called as vastus or magnus also. So this is called as adductor vastus or adductor magnus. And finally you have got a very beautiful muscle. You have got a very beautiful muscle, very thin muscle, guys, very thin muscle. I'm drawing as a single line. This muscle is attached to the tibia, and the tibia means your legs, your graceful legs, right? So you call it as a gracilis muscle. Gracilis muscle. Very good, very good. One is adductor brevis, two is adductor longus, three is adductor magnus. Perfect. Very good, perfect. Let us list it down, right? Why don't we list it down? What are the muscles we have studied? We have studied something called pectineus. We have studied something called adductor muscles. Adductor, three muscles we have studied. One is called adductor brevis. One is called adductor longus. Another one is called as adductor magnus. And finally, we have studied something called gracilis muscle. So, how many muscles in total we have studied, guys? We have studied these muscles. So, all these muscles, they are present in where? In the medial compartment. Now, can anyone please tell me what is the nerve that is supplying this medial compartment? Rishabh Kumar, thank you so much. What is the nerve that is supplying the medial compartment? Obturator nerve, very good. Obturator nerve is supplying the medial compartment. Sir, how can I remember all these muscles? It is really, really very difficult. Simple thing, guys. Remember it as gap. Right? G for gracilis, A for all adductors, P for pectineus. Okay? Remember in this way. If you remember that way, that would be fine. Okay, guys. So, did you understand? I mean, now I'll be giving you a break. Okay? After this break, we shall start. After this break, we shall start the femoral triangle. Okay, but till here, did everyone understand whatever I've taught you? Is it worthy? Yeah. Posterior, I'll tell you after the session, after the break. Yeah, the session is not yet end, right? Not yet finished. We shall take a break and then we shall continue the session. Okay. About adductor hiatus also I will tell you. Don't worry. Right, guys. So let us take a break. Okay. Let us take a break for 5 minutes, and then I'll come back. Okay. So all of you should attend the lecture, because right from here onwards, all the high yields start coming up. Right. Thank you. Right, guys? So let's start, right? Let's start. So what are we supposed to discuss now? Femoral triangle, right? We are supposed to so we are supposed to discuss now femoral triangle, isn't it? Right. But before I discuss femoral triangle, just answer these questions, guys. Let me see how you understood it. Okay, I know, I'm pretty sure that you definitely understood. Question number 151. Can anyone tell me the question? It was asked in 2018-19. Which of the following muscle is supplied by obturator nerve? Yes. Yes, fast. Answer me fastly, guys. I'm sure you definitely know the answer. Malhar? No. Very good. Excellent. Mahak? No, not C. Obturator nerve. Obturator nerve. Obturator nerve. Very good. Very good. Very good. Yes, very good. Varsha, very good. Mahak, you're right. Roy? Roy, you're right. Adductor brevis. Excellent, guys. So such simple questions will be asked, okay? And look here. Answer question number. Very good. The medial compartment muscle. Answer question number 178. Greetings. Yes, nice to meet you. Question number 178, guys. Which is the longest muscle of the body? Yes, you're right. Very good. Excellent. Super. Now, after teaching you the entire lower limb, definitely you'll answer all these questions, guys. You'll answer all these questions, and I'm 100% giving guarantee that you'll answer all these questions. Right. Sartorius muscle. Now, tell me true or false. This is a true or false statement. Okay. Sartorius muscle has got two heads. Did we discuss anything like Sartorius has got two heads? We did not discuss, right? We did not discuss, right? Attaches to anterior superior iliac spine. Is it right or wrong? True or false? Sartorius muscle attaches to anterior superior iliac spine. Am I true or wrong? Yes, tell me, true or false? True, very good, excellent. It attaches to anterior superior iliac spine, right? Does it attach to anterior inferior iliac spine? No. It is supplied by obturator nerve or femoral nerve. Sartorius, obturator or femoral? 4 or 5? Yeah, 4 or 5. Which is right? Which is true? Tell me only the true statement. 4 or 5? Femoral. Varsha Murugan, excellent. Femoral, right? Yes. Anjana Paul, femoral. Yes, you're right. So it is. Ranjan Kumar, you're also right. Everyone is right. Everyone is right. Excellent, guys. Abdul, you're right. Abdul, it is 5. Okay, it is 5. 2 and 5. Yes. 2 and 5. Sannyasi Pandit, 2 and 5. Excellent. Mahak, not obturator. Obturator is wrong answer. Because it is not a medial compartment, right? Yes, you're right, Mahak. Now let us enter into the major topic. The major topic, that is femoral triangle. regarding this femoral triangle, guys, one very important thing I want to tell you is that I'll teach you in such a way that you need not revise again. Okay. Second important thing is that whatever you learned about femoral triangle, I don't know if you wanted to forget it, just forget it. But whatever I'm teaching you, this will be the final part for your exams. Okay. So femoral triangle is very, very important, guys. Why it is very important? Because surgically it has got a very important role, because very important structures are located within this femoral triangle. Okay. Right. But anyways, in the femoral triangle also, you know the basic thing. What is basic thing? This is called as anterior superior iliac spine. Okay. And this is called pubic tubercle. And this is called pubic crest. And this is called pubic symphysis. Right. This is called pubic tubercle. This is called pubic crest. This is called pubic symphysis. Pubic symphysis. Connecting the anterior superior iliac spine to pubic tubercle, you have got a ligament like this. We have already discussed, and this ligament is called as inguinal ligament. And down here you have got a beautiful thigh. Okay. Now you will answer me one thing. There is a muscle that is starting from anterior superior iliac spine. It is making an S shape and it is coming like this. What is this muscle, guys? Very good. Excellent. This is called as your Sartorius muscle. Excellent, guys. Excellent. Okay. There is another muscle that comes all the way from the medial side, right? Medial side. And this is called as Edector Longus. This is called Edector Longus. So this will be your Sartorius. This will be your Edector Longus. Edector Longus. Shukri, you're right. Yes, you're right. Varsha, you're right. Rishabh, excellent. Yes, excellent. It is longus, adductor longus. Now, can you see a triangle here? Can you see a triangle? You can see a triangle, right? Now, this triangle here, this triangle which you can see, it has got three borders. One which is facing up, this is called as a superior border. Right, so this is called superior border. One which is facing laterally is called as the lateral border. This is superior border. One which is facing medially is called as a medial border. So three things we have. So this triangle is located in the femoral region. So you call it as a femoral triangle. Right. The same thing I'm drawing it in the form of a line. Femoral triangle, superiorly it has got, what is this? This is got inguinal ligament. Superiorly, it has got inguinal ligament. Laterally, it has got Sartorius muscle. Laterally, it has got Sartorius muscle. Okay. And medially, it has got Edector Longus muscle. Question number 1. The first question is finished. First question is done. The first question is, remember this. I will show you each and every question. First question is borders. What are the borders of femoral triangle is formed by what borders? Laterally Sartorius, medially Adductor Longus, superiorly inguinal ligament. First question is done. First question is done. Second question. Second question is this one. What are the structures that are located? Structures located in femoral triangle. What are the structures that are located in the femoral triangle? Look here very carefully, guys. Very, very carefully. You should pay attention now. Right. The structures which are located are NAV. From this direction, I mean from lateral direction to medial direction, we have got three structures. One is called NAV. N stands for nerve, that is called femoral nerve. A stands for artery. Some of you might have, you already started answering. Very good, excellent. Vinay Gangisetti, you are perfect, you are right. Okay. So laterally we have got nerve, femoral nerve. In the center we have got femoral artery. Medially we have got femoral vein. Okay, I will dive deep into that, but superficial I'm telling you. Okay, we have got a nerve like this. We have got a nerve. This nerve is called as femoral nerve. Next, we have got a cavity like this. We have got a cavity. Okay, this is called femoral sheath. What is this called? This is called femoral sheath. Within this femoral sheath, just listen, within this femoral sheath, you have got an artery like this. This is called femoral artery. Within the femoral sheath, you have got a vein like this. This is called as femoral vein. So what are the things I have got? Femoral nerve, femoral artery, and femoral vein. So femoral nerve is located outside the femoral sheath, whereas femoral artery and nerve are located within the femoral sheath. Now let us take up only the femoral sheath and see, are there any other additional structures within this? Okay, let us take up only the femoral sheath. So this is your femoral sheath. This is your femoral sheath. Okay, outside the femoral sheath, what was there? What is this? This is called as your femoral nerve. Outside you have got femoral nerve. Yes, Roy, I'll tell you the lateral and medial border in a minute. Okay, so outside you have got femoral nerve, and inside what all things you have got? You have got this artery called as femoral artery. Okay, and you have got this vein like this. This is called as femoral vein. This is called as femoral vein. Okay, now this femoral sheath is divided into three compartments. Femoral sheath is divided into three compartments. What are those three compartments? Look here. This is called as the lateral compartment. This is called as the lateral compartment. Next, look here. This is called as the intermediate compartment, and this is called as the medial compartment. So within the femoral sheath, there are three divisions. Within the femoral sheath, there are three important divisions. One is called lateral compartment, intermediate compartment, medial compartment. In the lateral compartment, what do I have? Femoral artery I have. What do I have? Femoral artery. In the intermediate compartment, what do I have? Femoral nerve. Femoral vein. Femoral vein. In the medial compartment, what do I have? In the medial compartment, I have got some lymph nodes. In the medial compartment, I have got some lymph nodes like this. Now, these lymph nodes are called as lymph nodes of Rosenmuller. Okay, these are called as lymph nodes of Rosenmuller, or the other name is lymph nodes of Cloquet. Lymph nodes of Cloquet. Okay, I mean, whatever you spell it, lymph nodes of Cloquet. Excellent. Ranjan Kumar, perfect. Shaima, perfect. You are right. Okay. Another structure also is there, guys. There is also another structure. Look here very carefully. This is a nerve. Okay, this is a nerve. What is this nerve? The name of this nerve is genitofemoral nerve. Genitofemoral nerve. This genitofemoral nerve has got two branches. So this is a branch 1, this is a second branch. Now this first branch is called as genital branch. Genital branch, which supplies to your genital area. And this second one is called as femoral branch, not femoral nerve. It is a femoral branch. Okay, femoral branch. Okay, now look here. This femoral branch comes down all the way like this. It comes down all the way and enters into which compartment? It is entering into the lateral compartment of femoral sheath. It is entering into the lateral compartment of femoral sheath. So overall, in a nutshell, if I have to tell you, within the femoral triangle, this is a sartorius, this is what? Adductor, and above you have got what? Above you have got inguinal ligament. Above you have got inguinal ligament. So in a nutshell, if I have to tell you, femoral triangle is consisting of, femoral nerve, just medial to that femoral nerve, what do we have? We have got femoral branch, Medial to that femoral branch, what do we have? Femoral artery. After that, we have got femoral vein, and after that, we have got lymph nodes. After that, we have got lymph nodes. All of you understood, right? All of you understood, right? Now, wherever this Sartorius and Adductor Longus are meeting, where is the meeting point, guys? The meeting point is this one, isn't it? So this is the place where the Sartorius and Adductor Longus are meeting. So that meeting point, from here Sartorius is coming, from here Adductor Longus is coming. Both of them are meeting. At the point where they are meeting, there is a small opening. There is a small opening at the point where they are meeting. Okay. This small opening is called as Edector Canal. This small opening is called Edector Canal. Or I can also call it as, where is this opening exactly located? Look here very carefully. My right hand is Sartorius. My right hand is Sartorius. Left hand is Adductor Longus. Look here. Sartorius is coming like this and it is touching the Adductor Longus. Now, if I ask you a question, where is Sartorius? You will answer me, Sartorius is located below Adductor Longus. Yes, it is located below. Below this Sartorius, you get a small hole. That is called Adductor Canal. As this Adductor Canal is located below the Sartorius, can I call it as subsartorial canal? Sub means below. Yeah. Can I call it as subsartorial canal? Yeah. Another name for this is Hunter's Canal. Hunter's Canal. Hunter's Canal. Avinash, you're right. Rajkumar, you're right. Varsha Murugan, you're also right. Excellent. Right? Did everyone understood? Did everyone understood whatever I've taught you? Did everyone understood the entire concept of femoral triangle? Yeah. Your comments are a little bit delay for me. Everyone, yeah. Notes I will give you, don't worry. Notes I'll send you in the group. We are creating a group where I'll be sending you all the notes. Okay. Now, look here. Let us go back to this. Let us go back to the place. Okay. Look here, guys. Tell me. Yes. Stop now. Stop commenting now. Yeah. Yes. And one more important thing I have to tell you is that, look here. Within this Sartorius also there are two borders. Now this green color border which I'm drawing, this is laterally facing. So this is called lateral part of Sartorius, lateral surface of Sartorius, isn't it? So look here. This is your Sartorius muscle. This is your Adductor Longus muscle. Okay. Sartorius, Adductor Longus. Now within this Sartorius, this part is facing laterally, so it is called as lateral part of Sartorius, lateral part of Sartorius. Then this one will be medial part of Sartorius, medial part of Sartorius. Okay. Now even in Adductor Longus also, see this part of the Adductor Longus is facing laterally, so it is called as lateral part of Adductor Longus. And this part is facing medially. This is called as medial part of Adductor Longus. Okay. If I ask you, in the group, I will add you in the group. Okay. Notes you'll get in the group, I'll add you in the group. So if I ask you, where is exactly what are the borders of femoral triangle? If they wanted to give you the question paper a little bit difficult, then you have to tell that superiorly, I have got inguinal ligament. Laterally, what is there? Sartorius. but exactly speaking, medial border of Sartorius. Laterally, there is medial border of Sartorius. But whereas medially which muscle I have? Adductor longus, you know. But exactly speaking, medially I have lateral border of adductor longus. Did you understand this box? This red color box? Did you understand, guys? Yes? Tell me first, did you understand this red color box? Yeah, before going to the MCQ, tell me, did you understand this? I'll explain what is gyrop's muscle. I'll explain you, but tell me, did you understand all this? Very good. Now look here. Look here, one last thing. Give me a second. Look here, guys. Look at this part over here. Look at this part. All of you might have known this, right? So this is your sartorius, this is your adductor longus. Above you have got, this is a superior boundary, this is the lateral boundary, this is the medial boundary. But all of them are forming the borders. Okay, see, this is a border, this is a border, but below also there are some muscles. So if I can show you like this, look here now. Let us say, okay, let me put it up like this. Okay, let me tell, this is your inguinal ligament, this is your sartorius, and these both represent your adductor longus. So they are forming borders, but deep inside you have got some 3 fingers inside. You have got 3 fingers inside. They form the base of femoral triangle. They form the base. See, triangle is like this. Triangle is like this here, right? So this is a triangle like this. But base also is important. Base is formed by 3 muscles. That is called XYZ muscles. So what are these XYZ muscles, guys? Tell me. What are these XYZ muscles? One X is called as psoas muscle, right? X is called as iliacus muscle. This is called iliacus. And Y is called as psoas major muscle. And Z is called as pectineus muscle. Okay, pectineus muscle. Remember it as IPP, or remember it as IMP, important. IMP stands for important. What is I? I stands for iliacus. M stands for major. What major? Psoas major. And P stands for pectineus. So these 3 muscles, they form the floor, or they form the base of femoral triangle. Floor or base of femoral triangle. Yes, I will add all of you to the group. Don't worry. I'll add all of you to the group. I'll put a number down. We'll post a number link down of the Telegram group below, and so that you can join. Okay, don't worry about that. So all of you are very good. You're answering perfectly, right? I'm really happy, and definitely if there are questions coming from this, definitely you will be answering, guys. There is no doubt at all, right? There is no doubt at all. Now, who will answer question number 154? Question number 154. Who will answer question number 154? What is the answer of question number 154? Femoral triangle base is formed by. This question came in 2018. I am looking at your answers now. Femoral triangle base is formed by. Base, Mahak, base. It is base. Not the superior border. Superior border is different, lateral is different, medial is different, but base, I've just told you, base. Excellent, guys. Very good. Very good. Malhar, Roy, Sanyasi Pandit, all of you are excellent. Sabika, all of you are excellent. Right? Base is formed by iliacus muscle. You see? Very good. Rishabh Kumar, iliacus, psoas. Psoas means psoas major, okay? Psoas major and pectineus, right? I know you meant psoas major only, right? So this is very important. Okay? Very important. Now, yes, psoas major. Very important. Now, I have already told you this is Sartorius, right? Sartorius, and this is Adductor Longus. Now, I have also told you that we have got an opening here. This is called a canal. This is called as an Adductor Canal. Okay. Now, tell me this thing. What is this border of Adductor Longus called as? What is this border of Adductor Longus called as? It is a medial border or lateral border? Tell me. Varsha, excellent. It is a lateral border, right? It is a very good. Malhar, it is a lateral border, right? Now, if someone asks you that, someone asks you a question that lateral boundary of Edector Canal is formed by. See, Edector Canal has also got two boundaries. Edector Canal also has got two boundaries. So this boundary is facing medially. This is called medial boundary. This boundary is facing laterally. This is called lateral boundary. So what is the question is, lateral boundary of Edector Canal is formed by. Yeah. Lateral boundary of Edector Canal is formed by. Very good, Shaima, very good. It is Sartorius, right? So there can also be questions like this, but they won't come usually. Don't worry about that. Okay. So, but anyways, very good, excellent. All of you are excellent. Now you will tell me this thing, guys. You will tell me this answer here. What is this? I am highlighting only this question over here. Okay. Now you will tell me this. What is the answer of, what is the answer? You know, even image based questions also come. Image based questions also come. Excellent, Roy. The medial border, you have the perfect answer, right? Satish, Naku, Manjana Patel, Sabika, Varsha, all of them, you're right. You're really best. So which muscle is marked as A in the femoral triangle? We have got femoral triangle. We know this muscle. I think this is Sartorius muscle. This is Sartorius muscle. And D muscle, what do you think, guys? What is D? What might be D muscle? What might be D? D might be, I think, Adductor Longus, right? Adductor Longus. What is A? What is A here? A is iliacus. Varsha, Roy, you both are right. A is iliacus. Malhar, Lahiri, you are also right. Mehak, you're right. Perfect. Perfect, guys. Excellent. So you're right. You're right. So we are done with the anterior compartment of the thigh. We are done with the functions and nerve supply. We are done with the medial compartment of the thigh. We are done with the functions and the nerve supply. Now let us discuss the major compartment, that would be your posterior compartment of the thigh. Posterior compartment of the thigh. Before I start on discussing the posterior compartment, I want to ask you that so far whatever I've discussed, did you understand? Yeah? Alok, hello. Yes, you understood, right? Very good, guys. Thank you so much. Let us discuss now the posterior compartment, okay? Posterior compartment. Now, in the posterior compartment, two things. Two things. Alok, I'm doing great. I'm doing great right now in the session. I would like even you to join. Thank you so much for asking. Posterior compartment, when you look someone's back, which you usually do, right? You find two things. What are the two things you see is that so this is what you see, right? So what are the things you see? What are the things you see is that this entire region is called as a thigh. Okay, in this thigh I see two things. This part is called as the gluteal region. This part is called as a gluteal region, and this part from here till here, this is called as back of thigh. This is called as back of thigh. So two things I see. One I call it as a gluteal region, and the other one is called as a back of the thigh. Okay. In the gluteal region, I have got some muscles. In the back of the thigh also I have got some muscles. Now let us discuss what are the muscles that are located in the gluteal region. Okay. So if let us say that this is the anterior side. This is your anterior side. Now in this anterior side, you don't have gluteus muscles. If I turn back here, you have got your gluteus muscles. Okay. So what are the muscles that are located within the gluteal region? And by the way, what is the nerve supply, guys? Sciatic nerve, right? What are the nerves that are located in the gluteal region? The first thing, one is called as a major gluteus muscle, right? One is very large, one is normal, and one is very small. So which is large, you call it as gluteus maximus. Which is a little bit small, you call it as gluteus medius, not intermedius. Okay, medius. It is not vastus intermedius, it is gluteus medius. Another one is called as gluteus minimus. Shaima, you're right, but these muscles which you have mentioned are the back of the thigh, like the semitendinous, semimembranous. They are at this part. Okay, we shall be discussing that in few minutes. So we have got three gluteus muscles. Three gluteus muscles. Apart from these three gluteus muscles, you have also got four muscles. How do I remember those four muscles? TOP, top question. No, if someone asks you a top question and if you answer it, you're really intelligent, right? Now, what are TOPQ? Yeah, T stands for tensor fascia lata. Tensor fascia lata. What is called as the peripheral heart? The peripheral heart is located in the leg. Okay, I'll tell you what is peripheral heart. Right, it is not located in the thigh, it is located in the leg. You know, when it compresses, when the muscle compresses, the veins, they send the blood fastly to the heart. You know, that is a different concept. I'll tell you. What is O? O stands for obturator internus. Very good. O for obturator, Girjes. Very good. Obturator internus. And what does P stands for? A pear-shaped muscle, that is piriformis. Excellent. Piriformis. And seventh one, Q. What does Q stand for? Yes. Quadratus femoris. So we have got tensor fascia lata, we have got obturator internus, we have got piriformis, we have got quadriceps, and one last muscle I want you to remember, guys. They are called twin muscles. They are called as gemellus. Twin means they should be two. One is called superior gemellus, one is called inferior gemellus. If someone asks you in the question, what are the twin muscles, then you should tell me, right? Twin muscles, then you definitely have to tell. Very good. So these are the muscles that are located in the gluteal region. In the gluteal region, what do you have? These are the muscles that are located in the gluteal region. Okay, these are the muscles that are located in the gluteal region. Now, let us discuss about very important thing about hip. In the hip, you know, for example, if let us say this is my hip, okay, I cannot stand up now. If this is my hip, I can laterally rotate my hip, I can medially rotate my hip, isn't it? If this is my hip, I can laterally rotate my hip, I can medially rotate my hip. So hip I can rotate two ways. One is laterally, one is medially. Fine, but why are you telling now? Why am I telling you is that there are some muscles which perform the lateral rotation. There are some muscles which perform the medial rotation. If you can remember this one, L stands for lops. L stands for lops. Okay, L means lateral. O means obturator internus. O means obturator internus. P means piriformis. And S means, what does S stand for, guys? S means superior and inferior gemelli. S means superior and inferior gemelli. So if you remember this mnemonic, then definitely you gonna get a question from hip. Hip is the most important thing. Okay, hip joint is most important thing. Definitely they will ask you, what are the flexors of hip? What are the extensors of hip? What are the lateral rotators of hip? What are the medial rotators of it? In this, definitely they'll ask you one question. So look here now. Yes, I teach to second year students. I teach to final year students, not only anatomy and physio anatomy and micro. I even teach biochemistry. I even teach remaining subjects like medicine, pediatrics also, right? But that is not important now. What is important is lateral rotators of hip, lobes, obturator internus, piriformis, superior and inferior gemellus. Clear? Right. M. Can anyone tell me what are the muscles that are located with, mentioned with the name M here? Mentioned with the name M. MED, medial. Where is the medial term here? I can see medial term here, right? Gluteus medius. So can I add that medial rotators of hip, one will be gluteus medius? Gluteus medius. Second thing, gluteus minimus. Gluteus minimus. Okay, two muscles, one is gluteus medius, another one is gluteus minimus. They are the medial rotators of hip. Sir, how to remember it? It is very difficult. See, I have made it as simple as possible, but more simple than this, if you wanted to know, then you better cut the body, dissect it, and when you see it, you'll understand it. Okay, but that is not possible here, right? So you have to remember it, because so far I have taught you by drawing the pictures, so at least there should be some things that you should know it without drawing a picture. Okay, so I hope you understood this. Now in the exam they are going to ask you a question that what are triomuscles? What are triomuscles? You know what are triomuscles? What are triomuscles? You know, we have discussed gluteus medius minimus here, right? Mention that gluteus medius, gluteus minimus, gluteus medius, gluteus minimus, and tensor fascia lata. Tensor fascia lata. Gluteus medius, gluteus minimus, and tensor fascia lata. These three are called as the trio muscles. And if you know, if you ask any anatomy professor that which is the important part in the back of the thigh, then definitely first thing they're going to tell you is that they will ask you a question on trio muscles. Trio muscles are very important, guys. Very, 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 very important. Okay, keep that thing in mind. So you understood? Are you understanding? Yes or no? Right? Are you understanding? Right. Now I'm going to draw something. I'm going to draw something that is going to make your life easier, guys. Now, what is that thing? Either it might be an upper limb or it might be a lower limb. Everywhere the nerve supply should be from your brain. Okay? This is your brain. This is your central nervous system. In this central nervous system, let me start telling you that we have got, let us say, L2 over here. We have got L3, we have got L4, we have got L5. I know the space is not enough, right? Space is not enough, right? L2, L3, L4, L5, right? S1, S2, S3. I'm not drawing more. I'm not writing more now. So these are the things. All these are the spinal segments. You know them. You know them. Now, this is the anterior region of the thigh. This is the anterior region of the thigh. Okay. Now I'm drawing the posterior region. This is the posterior part of the thigh. This is the posterior part of the thigh. What I'm trying to teach you, listen here, look here. What I'm trying to teach you is that from L2, from L3, and from L4, okay? From L2, from L3, from L4, all of them join together, to form a nerve, And this nerve will divide into two parts. One part going on to the anterior side, one part going on to the medial side. One part going on to the anterior side of the thigh. Which nerve? Be fast. Which nerve? Yes. Very good, Malhar. Very good. Femoral nerve. Medial part of the thigh, obturator nerve. Why I'm telling you this is that it is a favorite question for an examiner to ask the root values. They will simply ask you what is the root value of obturator nerve. Obturator nerve root value is L2, L3, L4. What is a, let us say, what is the root value of femoral nerve? L2, L3, L4. Okay, this is an MCQ. L2, L3 and L4 are the root values of two nerves. One is called as femoral nerve, another one is called as obturator nerve. I hope you are clear. In the front we have got femoral, obturator, only two. Let us go on to the back. Now in the back, look here. From L4, very good all of you, you have answered. L5, S1, S2, S3. All these together, they form very thick nerve, and that nerve is called as your sciatic nerve. That nerve is called as your sciatic nerve. And this sciatic nerve, guys, look here very carefully. This sciatic nerve gives a small branch like this. It gives a small branch, but the rest of the sciatic nerve comes down all the way till here. It stops, and again it gives another branch like this. Okay, so what is this branch? What is this branch which is going away? This is called as common peroneal nerve. This is called as common peroneal nerve. One very important thing I want to tell you is that most common nerve that is damaged in our body, that is common peroneal nerve. Okay, most common nerve that is damaged, most common nerve that is damaged, that is your common peroneal nerve. Okay, that is your common peroneal nerve. You know one thing, that if common peroneal nerve is damaged, there will be foot drop. Can anyone tell what is responsible for wrist drop? Which nerve is responsible for wrist drop like this? Yes, I want your answers. Excellent, everyone. Vasu, Brajesh, Sabika, Malhar, all of you are right. Radial nerve is responsible for wrist drop. In the same way, the nerve that is responsible for foot drop is common peroneal nerve. Common peroneal nerve is responsible for foot drop. Foot drop. Okay, foot drop. Now this common peroneal nerve also divides into two. One goes superficially like this, one goes deep inside like this. So one branch you call it as the superficial branch of common peroneal nerve, and the other one you call it as the deep branch of common peroneal nerve. Two branches, superficial and deep. Right. So sciatic nerve has given two branches. One is called common peroneal nerve. Common peroneal nerve in turn divided into two branches. One is called superficial nerve, another one is called deep nerve. Okay, what is the other branch of sciatic nerve? This other branch of sciatic nerve, this one is called as tibial nerve. Tibial nerve. Okay, it is called tibial nerve. Now this tibial nerve is also giving a branch like this. This is called as posterior tibial nerve. Why? Because it is located back. So it is called posterior tibial nerve. Okay. Simple. Why did I tell you this? Why did I tell you this is that, guys? Why did I tell you this is that muscles of the back are supplied overall by sciatic nerve, but in turn sciatic nerve there are many branches, right? So back of the thigh we have got hamstring muscles, right? Above gluteus, below back of the thigh, we have got hamstring muscles, right? So Shairi or someone was telling that there is semi-tendinous, semi-membranous, biceps femoris, right? So back of the thigh we have got hamstring muscles. All those hamstring muscles are supplied by your tibial nerve. Tibial nerve supplies your hamstring muscles. Next, in the leg region, back of your leg, that is called as calf muscles. All the calf muscles are supplied by posterior tibial nerve. Calf muscles are supplied by posterior tibial nerve. Posterior tibial nerve. So if I ask you what is the root value of sciatic nerve? Root value of sciatic nerve. Root value of sciatic nerve will be L4 to S3. L4 to S3. This is the question. Root value of femoral obturator nerve will be L2 to L4. Okay, L2 to L4. L2 to L4. Right? Did everyone understand whatever I've taught you, guys? Yeah? So far, till here. Let us stop till here and see whether you understood it or not. You understood? Everyone, everything, whatever I've taught you, did you understand? Right? So we have discussed till the gluteus region only. Now we have to discuss the back of the thigh. We have to discuss the lower limb, I mean the leg portion also, which we shall be doing in the subsequent session. Okay. So I don't want to, put a lot of things in your brain right now and make it messy tonight. Okay. So this is a Sunday night. I want you to enjoy. So I hope you enjoyed it. I don't want to over enjoy it. Okay. So that is the reason I'm stopping it here. But tell me, did you understand everything? Right? In the previous microbiology session, I hope you like it, right? All of your response was good. And tell me, even for anatomy, do you want me to teach the anatomy the same way? Do you want me to continue further sessions, or do I need to stop with this last session? Yeah. So do I need to continue further? Do I need to teach anatomy the way I taught you today? Did you understand it? Thank you so much, Anjana. Thank you, Sanyasi. Malhar, thank you. Vanilla, thank you. Thank you, Vanilla. Vishal, thank you. Yes, Sanyasi, I'll complete all anatomy and microbiology. I'll teach you, right? I was told to teach these two subjects, but after when I finish these two subjects, then I'll go on with the clinical subjects. I'll make you fall in love with the clinical subjects. Don't worry, right? Jayashree Rathore, thank you so much. Anjana Paul, thank you. Right. So let us end this session, guys. Thank you so much for your time which you have given to me for listening to my lecture. I hope this was really useful for you, right? So we shall continue this. I mean, I think next we shall be doing the micro session, right? We shall be continuing those topics, right? So regarding the notes, guys, we are creating a Telegram group. Okay, I'll post you the link of that Telegram in the comment section just below this video, below these live sections only. There will be a link that will be posted. So when you get an access to that, you will get an access to a group. There I'll post all the notes and everything. Okay. Thank you so much, guys. Take care, all of you. Goodbye.